Welcome to the new normal. I am Kathleen Palangan, a student nurse from Negros Oriental State University, and I will be discussing about how to do wound care. So, first of all, I would discuss first what is wound, classifications of wound, types of wound, aid for minor wounds, stages of wound healing, signs of infection, and the process to do wound care. What is wound? Wound is an abnormal break of the skin tissues and or in the underlying surfaces. What are the two classifications of wound? First is an open wound. So, open wound is the skin is split, cut, or cracked open, usually leaves underlying tissues and sometimes bones, muscles exposed to air, as well as dirt and bacteria. Second is closed wound. Closed wound, the skin is not broken, simply includes basic bruising, like where you bump into something and experience discoloration, redness, and bleeding underneath the site. A direct blow could cause more severe internal bleeding, tissue damage, and even muscle damage. Types of wound. First is the incised wound. A clean-cut wound results from surgical procedures or from skin being cut with a sharp object like knife or scissors. Second is laceration, a deep cut or tearing of the skin. Accidents with knife, tools, and machineries are frequent cause of lacerations. In a case of laceration, bleeding can be rapid and extensive. Third is abrasion, occurs when your skin rubs or scrapes against a rough or hard surface. An example of this is road rash. There's usually not a lot of bleeding, but the wounds needs to be cleaned. Fourth is contusion or bruising, a blunt blow or punch that ruptures capillaries of the skin. Fifth is puncture, a wound with small entry site but a deep tract of internal damage, usually round, caused by long pointy object such as nails or needle. Next is penetration. An object or a force breaks through the skin and damages underlying tissues, muscles, or organs. Have different size, shapes, and levels of severity depending on the cause and can be life-threatening. Avulsion, a partial or complete tearing away of the skin and the tissues beneath, usually occur during violent accidents such as body crushing accidents and explosions. They bleed rapidly and heavily. So lastly is bed sores, pressure sores, or decubitus ulcers are caused by pressure and or shedding of force on the skin. This generally occurs in persons who have limited mobility due to illness. First aid for minor wounds. First is stop the bleeding. So to stop the bleeding, you should wash your hands or put some alcohol, then apply pressure to the wound using clean gauze, clean cloth, tissue papers. If the blood soaks through the materials, do not remove the soaked material or gauze. Put another gauze or cloth above the soaked ones. If the wound is at the arm or limb, raise the limb where the wound is above the heart to stop the bleeding. Wash your hands again after giving the first aid and before cleaning and dressing the wound. Do not apply tourniquet unless the bleeding is severe and not stopped with direct pressure. Stages of wound healing includes prevent too much blood loss, defending and cleaning the area, and repairing and healing. So first stage is stop the bleeding or hemostasis. When you get a cut or a scratch or other wound on your skin, it usually starts bleeding. The first stage of wound healing is to stop the bleeding. Blood begins to clot second to minute after you get the wound. This is a good kind of blood clot that helps to prevent too much blood loss. Clotting also helps to close and heal the wound and making a scab. So second stage is scabbing over or clotting. Clotting and scabbing over phases have three main steps. First is blood vessels around the wound narrowed. Second, platelets, which are the clotting cells in the body clumped up together to make a plug in the wound. Third is clotting or coagulation includes a protein called fibrin. It's blood glue that makes a net to hold the platelet plug in place. Your wound has now scabbed over it. So next is inflammation, which involves cleaning and healing. Once your wound isn't bleeding anymore, the blood can begin cleaning and healing it. First, the blood vessels around the wound open a bit to allow more blood flows to it. This might make the area look inflamed or a little red and swollen. It might feel a bit warm too. Don't worry, that means help has arrived. Fresh blood brings more oxygen and nutrients to the wound, just right to balance. Fresh bloods bring more oxygen and nutrients to the wound, just right balance to help it heal. White blood cells called macrophages arrive on the scene of the wound. Macrophages help clean the wound by fighting any infection. They also send out chemical messengers called growth factors that help repair the area. You might see a clear fluid in or around the wound. That means white blood cells are at work defending and rebuilding. Third stage is rebuilding, and once the wound is clean and stable, your body can begin rebuilding the site. Oxygen-rich blood cells come to the site to create tissues. It's like a construction site, except your body makes its own building materials. Chemical signals in the body cells to tell around the wound to make elastic tissues called collagen. This helps to repair the skin and tissues in the wound. Collagen is like a scaffold that other cells can be built on. At this stage of healing, you might see a fresh, raised red scar. The scar will slowly fade in color and look flatter. So fourth stage is maturation or strengthening. Even after your wound looks closed and repaired, it's still healing. It might look pink and stretch. You may feel itchy or tightness over the area. Your body continues to repair and strengthen the area. Next is signs of infection. A wound may heal slowly if it's infected. This is because your body is busy cleaning and protecting the wound and can't get to rebuild stage properly. An infection happened when bacteria, fungi, and other germs into the wound before it fully heals. So first sign is slowly healing or doesn't heal at all. Second is swelling. Third is redness, pain or tenderness, hot or warm to touch, and oozing, pus, or liquid or discharge. So, treatment for an infected wound. First is to clean the wound. Second is removing the dead or damaged tissues around the wound, antibiotic medications, or antibiotic skin ointments. Steps for wound care. First is assessment. So, assess the level of comfort, assess the appearance of the dressing, assess the appearance of the wound and drains, understanding about the change, dressing, and wound care. Healing response to previous treatment, risk of delay or poor healing, need for pain medication. Next is nursing diagnosis. So what are the nursing diagnosis? Impaired skin integrity, impaired tissue integrity, and risk for infection. Next is planning or expected outcome. The site will be inspected. The site will have the proper dressing applied. The client or the family member will be able to verbalize understanding and demonstrate wound dressing and wound care. Implementation. First is, of course, wash hands. I am Kathleen Palanan, student nurse for today, and you have a doctor's order to change your dressing. So I will be here to clean and change your dressing. So the patient or the family member demonstrate the same thing you did. Play is evolution. The site was inspected. The site had proper dressing, and the family member and the client verbalize understanding and demonstrate wound dressing and wound care. So there you go. Thank you guys for watching, and if you have comments, suggestions, or anything that I did mistakenly, please don't hesitate to leave a comment or suggestions below. Thank you.